Hello. This is an autism video, and it is going to be about stimming, which is what I'm doing right now with my hand. You see that? You see that? You see that movement? Looks kind of weird and strange to you, doesn't it? But stimming is an autism behavior. It's kind of an important autism behavior. And I'll tell you why. Think of having a long day, you're tired, you just got home, you just want to get in a nice warm bath and relax. And you get in that bath and it's just, it's so much better. That's what stimming is like for an autistic person. It's relieving tension in an overexcited nervous system, or it is trying to ward off the effects of overexcitement. You know, I just had a really exciting day at church, so that's why I'm moving my fingers like this. It's a stim behavior. It's just relaxing. It's just kind of quieting down my nervous system. You know, it's kind of expelling some excess energy. I have a whole bunch of stims. Some of them you can't always see, like I do this a lot. So, but I press my lips together and I rub my lips together a lot. That's kind of a stim that's kind of not obvious, but if you're also autistic, you would kind of recognize that I do it often. You know, except when I'm wearing lipstick. Lipstick will kind of remind me, don't do that, because I don't want to smear it all over my mouth and look like a clown, you know. You know, I don't want to, not that kind of clown, a circus clown. So, and I apologize for the bad lighting. I don't have my mom's craft light because she's using it, so you're going to have to put up with my bags. Because I'm old, I'm 34, I'm an old lady now. But anyway, stimming, it's very important for autistic people, and there are some that can be kind of dangerous and painful for the autistic person. Like when I am very, very angry, sometimes I will beat the sides of my head because I just can't stand it, and I feel like my head is pounding, and when I get angry I feel like my head is just so. But you know, when you take away an autistic person's ability to stim, you run the risk of them having more meltdowns. And you may not see them because they might go in the room and hide when they're having it. Now, my meltdowns can look like a little kid's temper tantrum, or I will just have a crying fit that goes on and on and on and on. You know, because when I'm sad about something, I will cry and I will stop, and then I will start again, and then I stop, and then I start again. Whereas a meltdown, it just goes and happens and happens. A meltdown, I can just seem like I am irrationally angry about nothing. It might seem like I'm just in a rage. That's what it is, and that's what it feels like. It's like having all of your adrenaline just pumping, and you just don't know what to do with all the energy. So you just start screaming and fighting and throwing things and beating inside your legs or inside your chair or the wall or whatever's next to you. You know, not everybody does that, but I tend to like just, you know, I just have the urge to just smack my thighs. I just, you know, if I am literally going like this with my hands and I have my head down, it usually means don't come close. You know, it's okay to ask me if you're okay, because I will probably go like this. Like, that means no. If I shake my head and you ask me I'm okay, that means just leave me be. Just give me space, because there's a good chance that I cannot communicate anymore in words, because I can sometimes go nonverbal when I have a meltdown, which doesn't mean that I can't really say words. I can say words, but I may not say words that make sense in context with what's happening. Like, you know, I could be saying, it's not blue, or no, and it could be when you ask me a question about anything, and that will be my answer. I remember when I had a very bad ear infection in this ear 2 years ago, first ear infection in like 10 years, and it was so painful that I was unable to process anything. It was like trying to talk to somebody at a rave party where you just can't hear anybody. You can't. You gotta yell, and even then, it's hard to hear. And I was getting frustrated with my inability to process what people were saying to me. And I remember when I was at the doctor's office, the long wait was complete hell because there was some kid screaming, and I was already in a whole bunch of pain already, and so I was just like sitting there. I was just like, you know, I was whimpering because I was in so much pain. And I'm not someone that will show pain unless it's like significant enough. You know, when every month, when I have the cramps, yeah, I complain. It's like, oh, I got really bad cramps. But when I shift my position and they really kick my butt, I may feel like, oh my God, that's involuntary. And the whimpering I was doing at the doctor's office was involuntary too. And so when the nurse practitioner, when she was doing my blood pressure and asking me all kinds of questions, the only answers I could say was, I don't know. I don't know. I don't know. And my mom finally stepped in and said she's autistic, she's in a lot of pain, I have the info. And, they were able to get it done so that I could get into a quiet room. And once I was in a quiet room, I was actually able to talk again. But when I was waiting, and then when I was having all this stuff done, the blood pressure cuff felt good, but I like pressure stimulation. So I was able to talk when she had the cuff around my arm and when it was tight, but as soon as it loosened, I was back to, I don't know. So I was able to tell her that, I cannot have the pertussis vaccine because I'm allergic to it. It caused me to have seizures when I was a baby, but I don't remember because I was too young. My mom sure does. But, she was asking me about the date of my last period, and it was funny because I hadn't had it in a month, but then I went home that night and I got it on top of the ear infection, so that's probably why I was so overstimulated to begin with, because I was having some mild cramping feelings, but I just thought it was just because I was going to need to go poop later. Okay, I'm very body aware, so I kind of know when my body's doing that, but it was just, I was early that month for, probably the ear infection made me early, although sometimes it can make me late too. Being sick usually makes me late. But anyway, when an autistic person is in a situation where they cannot properly communicate, it's very likely that they will have a meltdown on you. And, it's not something they do on purpose. A meltdown, I don't have a meltdown because I'm trying to be difficult. I don't want to be having the meltdown, but it's like if you eat too much, eventually you're going to puke, right? A meltdown is my brain puking because it ate too much. So, if you got your head in the toilet with the worst food poisoning in your life, and you're puking, and somebody goes, oh, hey, I got this cake. You want this cake? Get that cake away from me. It's just like, get away, get away, get away. That's what I'm thinking, but I can't say it, so I just might be like, leave, go. Because I can only use very simple words, and even not words, so I just might just be like, and I gesture, or I might scream, get out! That was something my dad never would respect. I would tell him get out, and he would not. And then I'd have a meltdown, and then he would berate me for it. So, he can't do that anymore because he's so disabled by Parkinson's that he cannot just stand in my room and not respect my boundaries. I can just walk away from him now, but I couldn't all my life. And so I was taught to be ashamed of my meltdowns, and today I understand there's something I can't help. That sometimes they're just going to happen, and when I know it's going to happen and it's beyond the point of no return, I just kind of go like, okay, this is going to happen. I just got to minimize how much of it people see. Because sometimes I can like get away and go somewhere and then just let it happen. I can hold it for like a minute or two, but eventually it's just going to be like, boom. So, stimming helps to blow off the steam that builds up into a meltdown. It doesn't always work, but it helps. So you should never like shame an autistic person for stim behaviors like rocking back and forth. I do that a lot. Usually if I'm rocking back and forth, it can mean I'm either very happy or I'm very upset. You know, generally if I'm doing this when I'm rocking, that means I am happy. This is a happy stim. I only do this when I'm happy, and I sometimes do it when I'm nervous too, but usually when I'm nervous, I'm more likely to rub, and when I'm happy, it's just like a little seal. And it's like, yay! That's a happy stim. Both of them have the same kind of energy behind them, although sometimes I do this too. But when I'm nervous, I tend to do things like this with my hands. Or if I've got something in my hands, I will like rub my fingers together, or I might like shift my weight from foot to foot, like I might have to pee really bad. But stimming, it's very, very important that an autistic person be allowed to stim. And organizations like applied behavior analysis, which is often like promoted by Autism Speaks. Autism Speaks is a horrible organization. They don't have a single autistic person on their staff. Don't give to them. Give to the Autistic Self-Advocacy Network. They're better. Because they're autistic people that can speak, you know, for autism. Autism Speaks basically pledges understanding to the parents that murder autistic kids. There is no understanding. There is no excuse to murder a child. Period. Autistic or not. But Autism Speaks kind of sympathizes with those murderers. So, but applied behavior analysis aims to like discourage STEM behaviors, and they try to encourage kids to talk and act normal. And then they act like they're cured. No. You just train them to be ashamed of being autistic. You've made them afraid to STEM, and you have made them afraid to be who they are, which is a person who is autistic, an autistic person. It's like you're not going to teach a blind person how to make eye contact because they can't see you. You're not going to try to teach them how to not use a cane. They need that white cane. They need the guide dog. They need the braille. You can't take those away from a blind person. So why do you take stimming away from autistic people? You shouldn't. It's how we cope with the world. Just like a blind person uses their sense of touch to see the world. You would not discourage a blind person from touching things to learn about them, would you? No. Stimming has helped me learn about myself, actually. So I say encourage stimming. Let the child discover stims. The only stims I would ever redirect are ones that hurt them or, you know, hurt other people. And you should teach them some quiet stims to do, so that, like, if you go to church, they're not sitting there going, ha, ha, ha. You know, if they want to do that, they want to vocalize, let them do that, but teach them where it's appropriate and where it's not. And give them something they can do in place of that until they can go to a place where they can vocal stim. That was my ankle just cracked. Singing is my vocal stim, so when you're seeing my choir videos, I am stimming my head off, and I am a very happy person for it. And if somebody wants to take that away from me, they're going to have a hell of a fight. Because I will probably sing all the way to my grave someday. I will probably be singing. How can I keep from singing? I can't. Better yet, how about this? How can I keep from stimming? I can't.